Okay, we're going to be going over genetic disorders in maternal child, and it could be adolescent health or and health. It just depends on whether you want to say adolescent or and MCAH. And here's the learning objectives. We're going to be hitting genetic diseases in Chapter 12, and then also Chapter 18, the maternal and child health. I want you to know the common genetic disorders. I want you to know the infectious disease agents and toxic substances, teratogens. I want you to give me examples how public health measures can sometimes prevent unfortunate health outcomes. So there are examples in both of these chapters where that happens and where screening tools are used. I'm going to be asking you to identify those. I want you to give me up to 3 causes of congenital anomalies. Congenital means birth defects from birth. So you're going to need to know that by the end of the chapter. If you don't know up to 3 reasons, then I need to swing back and make sure you do. Infant mortality rates, they are used by public health professionals to really gauge the health of a nation. So when I tell you that the infant mortality rates are high for the United States, that's an indicator that there's something going on in our public health system. It means that healthcare or access to healthcare or prenatal care or something along those lines is not going well for us. That is like the litmus test, the barometer, the if your tank's running on empty gauge. If you see infant mortality rates high in a community, that means something's not going well. So I want you to make sure you know that. I want you to know the causes of infant death syndrome. Discuss the causes. A lot of these causes sometimes are not pinpointed, but I want you to know that there's some things that really put infants at risk. And then I want you to identify programs that support maternal child health. There's going to be a discussion question, and then you should be able to do both of the chapter reviews. So let's begin by looking at the first PowerPoint. I'm going to go ahead and click through this and discuss what you need to know. So just a little review. We're going to be talking about genetics and genes. And when something like a DNA is not duplicated or it's missing one of the chromosomes, genetic disorders can happen. So I had some of the learning objectives for today. So exposure to pathogens and viruses can cause genetics actually being replicated wrong, or during prenatal development can interfere. Screenings can be used in prevention and helping with treatment. And then there's some real ethical issues that sometimes arise with genetics and how information should be used. So let's go ahead and get ready with these terms. Do you know these key terms? These are the key terms that are in Chapter 12. I want you to know what carcinogens are. Carcinogens are cancer-causing agents. Correlation, that's a research term. Genomics is basically the study of genes and how they influence our health. Genetic disease, congenital means from birth. Teratogens, you need to know that term. We'll be discussing it. X-linked disorders, and toxoplasmosis, another one of those infectious agents that can interfere with prenatal development. So let's ask this, see if you're familiar with environmental teratogens. Teratogens, again, are anything that interferes with the development of a fetus. So do you know or have you heard of syphilis, rubella, toxoplasmosis, and the Zika virus? So in your chapter, slow down and read about those infectious pathogens and how they can actually cause birth defects. There are environmental chemicals like mercury that can interfere. And drugs. This is a big one. Hormones, prescription drugs. There's a huge list of them. And this is the reason why when someone's pregnant, before they even take a drug or even think about taking a hormone or doing anything over the counter and to prescription, They have to talk to their doctor because so many things can interfere with prenatal development. Now, there's some real sensitive stages in prenatal development, but in the very beginning, it's not as sensitive, but then it starts to get really sensitive towards one part of the period and then at the very end. But what you need to know is that exposure to a drug, the age of the mother who's carrying the fetus, and then also genetic predispositions can really influence how much a teratogen affects the fetus. So drugs are very much one of those. Alcohol is considered teratogen. Again, of course, that's a drug. Cocaine and heroin, again, drugs, okay, that can impact, not so much infect, but impact. So I want you to look up these different teratogens. So as I go through this, I'm going to be hitting the infection agents first, and then we'll move to the drugs. So one that you've probably heard a lot about is congenital syphilis. This is something that is an infectious agent that a woman can be exposed to and then can impact the prenatal development. Zika virus, you probably have heard of that. Again, transferred from a mosquito. Please hit these links and look these up. And then alcohol. Fetal alcohol syndrome is a big one. And in your discussion questions, discussion for this area, I'm going to definitely ask you to look up an infectious teratogen and then post something that you think is, define it, post something that's interesting, and then ask a question that you think needs to be pondered. And then you're going to be going back and forth in your discussion groups around teratogens. So please read up on these. So this is the jigsaw I'm going to have you do in your discussion group. I'm going to ask you to look up a teratogen. I'm going to ask you to find something that you think if it could be treated or not. And then I want you to come up with an interesting fact. So I'm obviously not going to give you a card, but in your discussion groups, I'm going to ask you to do that. So here are environmental teratogens that I'm going to ask you to look into. And actually this slide is a repeat. So these are the different teratogens again that I'm going to have you do in your discussion groups. The next thing I'm going to ask you to look into is genetic diseases. And this is going to be explored more, and you're going to hear about this in maternal and child health. But genetic diseases are things that are passed down genetically. It could be a missing chromosome in the genetic code, or I want you to look up page 179. I want you to make sure you understand how genetics work. You've probably heard of this, like the recessive gene, the dominant gene. Well, things can get passed on, and someone can be a carrier and not show have the symptoms. They can be something like that, or it could be only passed through the mother, or it can be passed on. So I want you to look at page 178 and have your head wrapped around this whole idea of recessive genes and dominant genes. So look at this page right here, 178. And you can see how a dominant gene for Huntington's disease, this is a very much debilitating disease that has no cure. And the father carries a gene on one of the pair of the chromosomes, and the mother carries two normal genes. Half of the children will inherit the disease from the father, while the other half will not. Okay, it's because the father's carrying the dominant gene. This is called a dominant dominant disorder. So it means it's being passed on. The other one is a recessive disorder, and this is sickle cell anemia. You probably have heard of this. And then, so what happens is that the mother and father both carry this gene. And then what happens is that it has to have, both of the recessive genes have to show up in order for the child to have it. Okay? So genetic diseases. One of the big things is that it can be caused by new mutations also. So we talked about epigenetics, where this idea, and hopefully I'm going to have a slide on this, but look up this term if you're not familiar with it, is this the idea that an environment can switch on a gene or switch it off. And there's some things that can be affected by this. So encephalitis is when the brain is not there or it's completely removed. And folic acid supplements can actually reduce the risk of one of these genetic conditions. So that's the reason why all women take folic acid supplements during pregnancy. And there are some things that can actually influence that. And here's the thing is that it could be one of these things that can be prevented. So look at page 179 and read up on that. One of the big things, and I want to say that when we go into maternal, child, and adolescent health a little bit, also you need to know that putting iodine and different things in the supplements of our food, and when a woman's taking prenatal vitamins, these are also things that help prevent. So look at page 183. These are all the different screenings that can be done. Now, let me tell you, here's when it comes to this, these screenings can be used to help prevent sometimes genetic disorders or help treat a condition as a person's as a newborn's being born. They can know that someone's going to have more of a risk for hypothyroidism, and be able to treat. But at the same time, there's an ethical dilemma that starts to come up, because what happens if you can't treat it? What do you do then when you give this information to somebody and they start to make decisions then about having a child or not having a child, or decisions around what they're going to do? We also have something called in vitro fertilization, where people can actually start to manipulate the genetic coding, or put two recessive, manipulate the father and the mother's genes, so that, and eggs, and who's being exposed, so that you can reduce the risk. So that's something that kind of starts to come up on page 85. Is I want you to look at both the screenings, but then also read about some of the ethical issues that starts to come up when we start to diagnose diseases. So we can prevent sometimes using screenings, but then at the same time we have ethical considerations to think about when we're starting to provide this information to people. So I want you also to look at what screenings are in California and what this means, okay? So I also want you to read up about how carrier screenings, what people need to know. And look at this. So let's take one of these diseases like prenatal screening for HIV. Here's the great thing about HIV now that we've gotten, we've really improved our medicine around it. If a mother's diagnosed with HIV, they can actually start to give and do interventions to ensure that the fetus does not get HIV. 1. 2, Tay-Sachs disease in Jews. This is something that was encouraged by Jewish leaders. You can read about this matchmaking. And there's a lot of trust in all that, because people would get identified with having the disease, but then be partnered up with someone who does not have the disease, so that they could start to isolate it genetically and reduce the spread of this disease. This backfired with sickle cell disease in African Americans, because that started to happen. They started screening African Americans who were more prone to have this genetic disease, sickle cell disease. And again, what that started to do is people started to feel like they were having their privacy invaded, and it did not go well. So read about that too. There's something called genomic medicine, where you start to look at, who's carrying the genetic disorder, who's not. You've heard of BRCA1 and BRCA2. These are genetic tests to see if someone carries breast cancer. And you probably have heard of, what's her name? Brad Pitt's former wife, Jolie, whatever, I forgot her name, famous person. She actually got a double mastectomy because she thought she had this carrier of the disease. So the idea is sometimes knowing about these things, you could start to prevent. So that's something else too. So here's the thing for guidelines for genetic screening. When it comes to genetic screening, it's only beneficial when you know that you can actually treat. So that's one of the things that they started to say is that, okay, we'll make these guidelines for genetic disorders. These are recommended screenings, but we're not going to really recommend the screening if we can't do anything with it. People should feel like it's voluntary and it's confidential, and there should be counseling. So you should not be doing screenings on people without their consent. Hello, duh, right? Prenatal diagnosis should include education and counseling. All tests need to be high quality so people don't have false positives or false negatives. That could be a real problem. So you need to make sure it's high quality. And there needs to be a lot of education out in the general public so people understand about genetic testing before they start getting it done. So these are some of the ethical questions and discussion questions that I want you to think about. What are the ethical issues involved with prenatal diagnosing each of the following genetic diseases? I'd like you to think about that one. From an ethical perspective, how is a newborn screening different than screening people in certain racial or ethnic groups who have recessive genes? How's that different? 3, what would be the benefits and drawbacks of including tests for BRCA1 and BRCA2 in newborn screening programs? And then I want you to look at the website and start to look at the different genetic diseases out there. What are some hot areas, some hot topics for genetic diseases? And then the last discussion question is looking at, do you know your family history of what genetic areas, do you know what information would be useful for you? And what would be some drawbacks of collecting this information? And I'm not going to ask you to go into this one, but if you're interested, you could just click on this website and look around. So what I'm going to do for your discussion question is I'm going to pull from one of these, and then I'm absolutely going to ask you to identify some teratogens and discuss those, okay? So get ready for that discussion question. The next one is maternal, child, and adolescent health. Now, I'm going to go through these slides pretty quickly because you're going to see there's some crossover. I want you to know what these congenital anomalies are, and I want you to be familiar with all these terms. Infant mortality rate, SIDS, WIC, SNAP, prenatal versus small for date. Do you know what socially economic status, what SES means? Look up these terms. So I told you that infant mortality rates are how public health officials gauge overall health, and that low birth weight is correlated with socioeconomic status. So what that means is that the higher the lower the income, the lower the birth weight. And I'm going to tell you that one of the 3 leading causes of infant mortality, this is in your discussion question, and this is going to be a test question, are congenital anomalies, birth weight, and sudden infant death syndrome. And so congenital anomalies means genetic, they could be genetic birth defects or exposure to an infectious agent that causes an anomaly. So teratogens would be those. So 3 leading causes of infant mortality are these 3 things, okay? One of the big ways to reduce infant mortality is to have family planning. So look at page 296, please, and read that. So I want you to look at this database and look at where we have a visual here of, this is really cool, of deaths in the United States. And this gives you an idea of adjusted death rates and life expectancy at birth, okay? And you can actually go in here and see the different chart types. And here's drug mortality, this is teen birth rates. So this is important for you to know that if the younger, actually teen births have lower infant mortality rates. I meant to say lower birth weight. They have lower birth weight, okay? So that means that they're more at risk for infant mortality. And so these are birth rates for unmarried women. So you can kind of just click on here and get some really good visuals there. So let me get back to my PowerPoint. So how are we doing for infant mortality rates in the US? Our infant mortality rate is one of the higher ones in the developing world. in the developed world. You probably go, why is that? So our infant mortality rate is 6.1. So what that means is that for every 1,000 live births, we have 6.1 deaths. So I'd like you to read this article that I'm going to be posting, and I'd like you to put down 3 key findings and what you thought about it. So I'm going to ask you to read that article. So these are the 3 big takeaways. Birth defects are leading cause overall, so congenital anomalies, premature and low birth weight, and then sudden infant death syndrome. Social factors in infant mortality. Poverty is the number one of the biggest risk factors. And then social economic status puts women more at risk. Can you think of a reason? Access to health care, nutrition, stress. Stress is a big thing too. So here are some things that you think about. These are all related to low birth weight. So low birth weight is not completely understood. Gum disease is associated with preterm deaths, births. I meant not to say deaths, but births. So having good access to health care and dental care is a big thing. Prenatal care, reducing adolescent pregnancy. And then recent increases in low birth weight due to multiple births because of reproductive technology. Again, back to that article, read about it. So what are some ways that you could prevent? Can you name 6 of them? I just went down 4. Can you name the last 2? So genetic and newborn screening, FDA regulation of teratogenic drugs. Yes, say that 5 times. Warnings against alcohol for pregnant women, prescription pain medications, immunizations of children against rubella, because that is an infectious teratogen, and then dietary supplements with folic acid. Okay. So the other programs, I told you that we're going to hit on programs. One of them is called Prenatal and Perinatal Care. It's called the Prenatal Outreach Program. This is when you start to come in and you start to give both prenatal care, and then also you help after the birth a little too, okay? These are some of the things that are considered evidence-based programs where nurses partner with families to help with first-time mothers. There's a lot of evidence showing that this makes a difference. The other thing too is sudden infant death syndrome. So low birth weight is a big cause, smoking and drug use, and then having a child on their back to sleep, okay? And not having a lot of pillows or anything around, and really making sure that airflow is really good. So the big thing is that the risk for infant death syndrome drops after 4 months. So the first 4 months is really important. So let's talk about adolescent pregnancy and teen birth rates. We have one of the highest teen birth rates in California. We're up there. So that means that we also have probably a higher infant mortality rate because we also have a lot of teen births. So a lot of times people don't know what about contraception, and you heard that family planning is really important in order to have and to reduce, well, in order to reduce low birth weight, okay? So family planning is key. So the big question is, do you think people know the different types of family planning? Sterilization, hormones, IUDs, barriers, condoms. Which one do you think is the most effective? If you had to rate them, which one would you put? And then there's a contraception ranking. And so there's a handout that's in the module, and I'm going to have a little contest to see who could put them in order the quickest. Okay, so I might have a Kahoot challenge going out. So the other thing too is I want you to know that there's, besides family planning, also providing milk stations and giving food to children really does help with development of children. So that's one big thing. And then breastfeeding. Breastfeeding is very important. It helps with nutrition, but it also boosts the immune system of a child. So I told you that we were going to hit on WIC. This is Women, Infant, Children. there are school programs for free and reduced lunch, summer food, and there's something called SNAP, which is basically food stamp programs. But still, food insecurity is still very common in the U.S. When I say by food insecurity, that doesn't mean people are starving. It means they don't have access to good, quality, healthy food. So one of the big things that I'm going to ask you is, what programs are available to really support mothers and children? And one of these programs is called Children's Child Health and Disability Prevention Program. And it basically provides free immunizations, free child wellness exams. And this is extremely important for a child in their first year infancy, as you can tell that they're more exposed and they're more susceptible. So getting these regular child care checkups are extremely important, and they are free. Okay. So why is the health of infants and children especially concerned for public health? Why do you think that's important? What are the 3 leading causes of infant mortality? And for each cause, can you tell me 2 or more public health measures aimed at reducing the risk? And so those are the 2 discussion questions for this. And I'm going to be pulling out one of these to put out there in our discussion question. So for this week, those were the 2 chapters. And then I'm going to be linking the discussion questions. And then, of course, you have your chapter reviews. I will also be grading all the midterms, and I will be putting extra credit out there on the questions that were missed the most with a Kahoot. All right. Have a great week. And make sure to message me with any questions.